meet you all,
Thank
and
you.
kudos to you on what you're trying to do for the practice. So I am Onaoluwa Abimbola. I'm a senior medical laboratory scientist practicing in Ogun State, Nigeria. And I think that's like the basic info.
Yeah,
Or you want me to talk about other things?
it's fine.
Yeah, we know.
It's fine.
You know, there's more to you.
We know there is more.
We have four major sections of the discussion, and the first one is looking at the current status of the profession in Nigeria, the workforce, the manpower, which we know determines how healthcare services spread across the country. The more the manpower, the more we are likely to have adequate services to our people. So with the current data and record in Nigeria, do you have an update about the current manpower?
That's a technical question, which I think the Medical Laboratory Science Council of Nigeria will be in the best position to answer.
Okay.
Going by the array numbers of recent inductees, we have more than 25,000 medical laboratory scientists in Nigeria.
Licensed?
However, sorry?
Licensed, professionally licensed.
Yes, professionally licensed medical laboratory scientists. Okay. That's like going by the array numbers. However, there was a recent interview by the national president for Association of Medical Laboratory Scientists of Nigeria, which he said that we have produced over 40,000 medical laboratory scientists professionally licensed to practice, but that's the JAPA movement. That's like migration of young medical laboratory scientists from Nigeria has taken more than 10,000. And I think the Medical Laboratory Science Council of Nigeria, the registrar, recently also gave, maybe it was a report that in the past year alone, over 4,000 medical laboratory scientists left Nigeria.
Well, notwithstanding, can I just ask, I know that we have other associated professionals under medical laboratory science, such as medical laboratory assistants, technicians, and maybe associate practitioners. Why discussing this as well? Do you have any hint about the level of distribution of manpower for those others related practitioners?
Technically, it seems that medical laboratory assistants have gradually been phased out of the system. Like the Medical Laboratory Science Council Act provides for the training of medical laboratory scientists, medical laboratory technicians, and medical laboratory assistants. But if you visit the colleges of health where the medical laboratory assistants are supposed to be trained, you will not find those programs in existence anymore. And for the facilities I'm familiar with, we employ health attendants who are not specifically medical laboratory attendants. So we have to do in-house training for them to bring them up to speed to some of the things that are peculiar to the medical laboratory. So based on the fact that the medical laboratory assistant cadre is, like a very low or bottom cadre, it seems it has been phased out. But we do have medical laboratory technicians, and there are so many schools that are still running that program. And the current policy actually employs, or should I say, recognizes the employment of medical laboratory technicians in the rural areas and primary healthcare facilities. So that is where their major distribution is. We also have them in the tertiary and the secondary, but they work under the supervision of medical laboratory scientists more in those places. Whereas in most of the primary healthcare facilities, you might have medical laboratory technicians working with minimum supervision from like a regional medical laboratory scientist covering so many facilities. So some of the primary healthcare boards now have started employing more medical laboratory scientists as they see that, okay, there's a need. They have started employing more. But the distribution is more or less like you have more medical laboratory scientists in the tertiary facilities. Those are like teaching hospitals or bigger hospitals like federal medical centers. And then you have more also in the state hospitals, which are secondary care facilities. But more of technicians in the primary healthcare facilities, the ones that are closer to the community.
Okay.
That's like the average way I can describe the distribution.
Yeah. It is clear. It's clear. Tertiary, you have more scientists, fewer technicians. State level as well, you have more scientists, fewer technicians. Then at the primary level,
Yes.
you have more of the technicians.